everyone, and welcome to The Balancing Act. I'm Olga Villaverde.
And I'm Montel Warren.
Today, we're learning more about locally advanced basal cell skin cancer.
And we won't have to wait too long. A ballet school visit is heading our way.
I love it. Plus, credit score information you need to know.
Balancing Act begins right now.
Tutu.
Tutu.
That was very cute.
You may be familiar with the term basal cell skin cancer because it's the most common type of skin cancer.
Yes, but if you haven't heard about locally advanced basal cell skin cancer, listen up, because it is a rare form and is often difficult to treat.
And that's exactly the case for Kara, whom you're about to meet right now.
One day I noticed that I had this red little dry patch on my chest and just kind of kept watching it, just thinking it was, just a skin irritation of some sort, and it would never heal, and it just kept getting a little bit flakier and more red. So I made an appointment with the dermatologist, and they did a biopsy and discovered that it was basal cell carcinoma, and because of how long I had let it go, I needed to have surgery to get rid of it. And then in 2018, I noticed a dry area on my scalp, and it wasn't healing. I started thinking more about the basal cell that I had on my chest. I thought that, I've been outside running. I don't use sunscreen on my head, so I thought I probably need to go to the dermatologist and have it looked at. And he did a biopsy and discovered that it was in fact basal cell carcinoma.
Basal cell skin cancer is usually caused by sunlight or UV radiation. Thankfully, this isn't the type that gets into your bloodstream and causes issues that way, but it does continue to grow, which is why we want to treat it. The most typical way we treat a basal cell skin cancer is with surgery. We'll cut the area out. Sometimes we'll do Mohs surgery where we check all the edges to make sure that the tumor is all gone. Typically, basal cells can be completely removed, but in rare instances, they can return and grow large. Or it's in an area that is just a bit more difficult. Think of the nose or the ear or a large tumor on the scalp. At this point, the cancer becomes locally advanced or locally advanced basal cell skin cancer.
After a couple years had went by, I noticed a couple spots, one on my nose, one on my ear. I reached out, made an appointment with Dr. Farberg. He did a biopsy. Dr. Farberg told me that the basal cell was advanced. It was very emotional, very kind of discouraging because I had just went through it and just, wanted to know all my options and how I could make this best fit my lifestyle to where I wasn't, having to, go through all of that again.
With locally advanced basal cell skin cancer, I'm considering a number of different factors, such as its size, where it is on the body, how deep it is, or whether or not it's recurred. We have to remember that certain areas are very difficult to treat surgically. Think about the nose or the ear. And in particular with locally advanced skin cancers, these are growing deeper. And so any sort of surgery could leave the patient with disfigurement. I spoke with Kara and we discussed all her treatment options. And together we decided that the once daily pill Odomzo made the most sense for her. Odomzo, also known by its generic name sunitinib, is a prescription medicine used to treat adults with locally advanced basal cell skin cancer that has come back following surgery or radiation, or that cannot be treated with surgery or radiation.
What is the most important information I should know about Odomzo? Odomzo can cause your baby to die before it is born, be stillborn, or cause your baby to have severe birth defects. Odomzo should not be taken by women who are pregnant. For females who can become pregnant, you should talk to your healthcare provider about the risks of Odomzo to your unborn child. Your healthcare provider will do a pregnancy test before you start taking Odomzo. In order to avoid pregnancy, you should use birth control during treatment and for at least 20 months after your final dose of Odomzo. Talk to your healthcare provider about what birth control method is right for you. Talk to your healthcare provider right away if you have unprotected sex or if you think your birth control has failed. Tell your healthcare provider right away if you become pregnant or think that you may be pregnant. The complete safety information will be shared at the end of this segment.
After taking the medication for 6 or 7 months, I came back in. He did another biopsy and discovered that the basal cell had shrunk by like 50%. I did experience some side effects, but they were very manageable for me.
It is very important that all patients speak to their healthcare providers about the risks and side effects, which may include muscle spasms and increased risk of muscle pain, tiredness, or abdominal pain. Some might experience headaches, hair loss, and itching, or even change in taste, decreased appetite, or nausea, diarrhea, or vomiting. In my experience, it's important to find a medication that is tolerable and manageable for the patient.
I'm a huge advocate that if I see something on my skin that doesn't look normal or that isn't healing, I just call my dermatologist and get it checked out.
I can't stress enough that if you have a spot that you're worried about, please go see your dermatologist and get it checked out. It doesn't take more than a minute, and if it is something, hopefully we've caught it very early when it's most treatable. There are a few things that can increase a patient's risk for locally advanced basal cell skin cancer. These include age, gender, their sun exposure, and in some instances, even their genetics. And don't forget to always wear your sunscreen. Prevention is always key.
For more information about locally advanced basal cell skin cancer and Odomzo, go to odomzo.com. And as always, you can go to our website, thebalancingact.com. Please stay tuned for more important safety information. What is Odomzo? Odomzo sonitigib is a prescription medicine used to treat adults with a type of skin cancer called basal cell carcinoma that has come back following surgery or radiation, or that cannot be treated with surgery or radiation. It is not known if Odomzo is safe and effective for children. Important safety information. What is the most important information I should know about Odomzo? Odomzo can cause your baby to die before it is born, be stillborn, or cause your baby to have severe birth defects. Odomzo should not be taken by women who are pregnant. For females who can become pregnant, you should talk to your healthcare provider about the risks of Odomzo to your unborn child. Your healthcare provider will do a pregnancy test before you start taking Odomzo. In order to avoid pregnancy, you should use birth control during treatment and for at least 20 months after your final dose of Odomzo. Talk to your healthcare provider about what birth control method is right for you. Talk to your healthcare provider right away if you have unprotected sex or if you think your birth control has failed. Tell your healthcare provider right away if you become pregnant or think that you may be pregnant. For males, it is not known if Odomzo is present in semen. Do not donate semen while you are taking Odomzo and for at least 8 months after your final dose. You should always use a condom even if you have had a vasectomy during sex with female partners who are pregnant or who are able to become pregnant during treatment with Odomzo and for at least 8 months after your final dose to protect your female partner from being exposed to Odomzo. Tell your healthcare provider right away if your partner becomes pregnant or thinks she is pregnant while you are taking Odomzo. If you become pregnant during treatment with Odomzo, you or your healthcare provider should report your pregnancy to Sun Pharmaceutical Industries, Inc. at 1-800-406-7984. What are possible side effects of Odomzo? Odomzo can cause serious side effects, including muscle problems. Odomzo can increase your risk of muscle pain and rarely a serious condition caused by injury to the muscles, rhabdomyolysis, that can lead to kidney damage. Tell your healthcare provider right away if you develop any new or worsening muscle spasms, pain or tenderness, dark urine, or decreased amount of urine during treatment with Odomzo. Your healthcare provider should do a blood test to check for muscle problems and to check your kidney function before you start taking Odomzo, during treatment, and if you develop muscle problems. The most common side effects of Odomzo include hair loss, change in taste, tiredness, nausea, diarrhea, weight loss, decreased appetite, vomiting, stomach area, abdominal pain, itching, headache. What should I tell my healthcare provider before taking Odomzo? Before you take Odomzo, tell your healthcare provider if you have muscle pain or spasms, or have a history of a muscle disorder called rhabdomyolysis or myopathy, have any other medical conditions, are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed. It is not known if Odomzo passes into your breast milk. Do not breastfeed during treatment and for 20 months after your final dose of Odomzo. Talk to your healthcare provider about the best way to feed your baby during this time. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Odomzo may affect the way other medicines work, and other medicines can affect how Odomzo works. Taking Odomzo with other medicines can cause serious side effects. How should I take Odomzo? Take Odomzo on an empty stomach at least 1 hour before or 2 hours after a meal. What should I avoid while taking Odomzo? Do not donate blood or blood products while you are taking Odomzo and for 20 months after your final dose. Do not donate semen while taking Odomzo and for at least 8 months after your final dose. General information about the safe and effective use of Odomzo. Do not use Odomzo for a condition for which it was not prescribed. Do not give Odomzo to other people even if they have the same symptoms that you have, as it may harm them. You can ask your pharmacist or healthcare provider for information about Odomzo that is written for health professionals. You are encouraged to report adverse reactions of prescription drugs to Sun Pharmaceutical Industries, Inc. at 1-800-406-7984 and to the FDA. Visit www.fda.gov/MedWatch or call 1-800-FDA-1088.
At Russell School of Ballet in Virginia, they teach ballet and other dance styles to children, teens, and adults.
So let's put on our toe shoes and learn more.
Welcome to a world where grace meets discipline and dreams take flight on the tips of toes. Ballet is a delicate art form where aspiring dancers can showcase their love of emotion and expression, while also showcasing their immense strength and passion.
I fell in love with dance when my daughters and my son started dancing, and I really thought that it was a great activity for them. We have dancers here from the age of 3 all the way up to 80. It's just a very friendly and community-based and family-based space. We're considered a pre-collegiate, pre-professional program, so if they really want to go on to dance and study it in college, we help them to get to where they want to be, and if they want to go on to do it professionally, we're helping them also try to get there as well.
Here at RSB, we really want to foster growth in the dance and the idea that dance can be an expression of your emotion or the music that you're hearing. Different technique classes will have different music that will elicit different responses. So we really look for that well-rounded experience. So we give dancers the option to take ballet, modern, jazz, so you get those differing techniques and then the musical experiences within those. Dance is very much a nonverbal artistic expression. Being able to use your body to say something and then being able to have a conversation with another person who may not even speak the same language, but you can understand each other because you're moving your body in such a way that you can convey a thought or an emotion.
With 55 years of ballet excellence, the Russell School of Ballet offers families a wonderful and nurturing environment in which to perfect their craft.
Any show we put on is a full family with my mom, with my sister, artistic director, and then our entire staff and also our parents' families. Everyone supports each other. We're there to have each other's back. We all have different strengths and weaknesses. If a student is struggling with with something, we'll have a conversation. How can we help you? So it's really a village and a community here, which is really, really beautiful. Here at Russell School and the Fairfax Ballet, we offer 3 shows a year: a Nutcracker with a live symphony orchestra, a spring ballet, and a jazz tap modern review.
Everyone's looking for something to do to release from the everyday stresses. And I think dance is great for the mental, for the physical, and for the health benefits. And sometimes just stepping away from life, leaving your troubles at the door, I always say to the kids, and including my adult students, and stepping into the studio and just working on yourself for 90 minutes can be the reset you need. Carla, Gwen, Emily, and I, we really try to make sure the kids are celebrating who they are as bodies, who they are as individuals, and who they are as humans. Celebrating that diversity is really important for us. Finding a place for all of our students, regardless of their ethnicity, regardless of their size, regardless of their gender identity, is really important for us. Making sure that dancers, regardless of how they learn, whether they have a learning disability or developmental disability, they can still come be part of our community. And we make sure that our kids know that too. So I think that shows in our dancers. It's a healthy environment and the kids really celebrate each other. And that's really special. Putting on our shows each year is really magical. And then you get to the theater and the lights go up and you're really setting that mood that you've created. Carla has shown you a beautiful costume, as you see behind me. We're really lucky to have her. And all of a sudden, this vision that you had comes to life and the dancers get excited. Even our little ones, all the way to our older ones. There's just this magic, there's this energy, and you can't get that anywhere else.
There are also a variety of other dance classes available, including jazz and tap.
What inspires me about dance is the smiles on the kids' faces, the excitement that they have when they accomplish something, and when they perform, that they're very excited that they did that and they want to do it more. Dance is for everyone.
To learn more about Russell School of Ballet, visit the website at rsbdance.com or see this segment again on thebalancingact.com.
Even hard-working people with jobs fall on hard times, and no matter how financially responsible we try to be, we still need help improving our credit score. After all, a credit score can influence important things like getting an apartment, a house, a car loan, and even school loans for more education. So many things. Well, today, we have a leader from PREMIER Bankcard to help us with some straightforward ways to help build that credit score. And with me is Stephen Corsi. Welcome.
Thank you very much.
All right, so out there are so many people that could be hardworking, doing all the right things, trying to get ahead. Credit score, woof, holding them back.
You said this very well, Olga. Credit score is key to opening so many important doors for people. Even people who've been really responsible with their debt and with their credit over the years can fall into hard times. It's a common issue that we see a lot of people struggle with. We believe your credit score isn't a reflection of you, it just tells us where you are on your journey.
And we have a few things we can focus on today, right?
Absolutely. First, knowledge is power. You want to get yourself a copy of your credit report. You want to make sure that it's accurate, and if there's any changes, you want to make sure you get them corrected. After that, you want to make sure that you make all your payments on time and you don't miss a payment. You want to be able to catch up on any past due accounts and get them current. And finally, you want to manage your balances. If you do these things consistently, you will start to see your credit score rise over time.
Great bullet points. I love these. Know your credit score, make your payments on time, catch up on past due accounts, manage your balances. Now let's talk about debt.
Yes.
Good, bad, both.
So debt in itself is not bad. It's when it's how you manage debt, and if debt takes control of your life, that it becomes a problem. And another tip is to make sure that you don't live beyond your means. You want to make sure that you can maintain your balances and make sure that debt doesn't get out of control. And if you do start to backslide, there are companies out there that will help you get back on track.
So let's sum up what you just said. Debt is not a bad thing. Keep debt within your means.
Yes.
Credit cards can be great tools, especially with PREMIER.
Yes.
Now, Stephen, just to kind of finalize this, there's a lot of people out there that'll say life happens, right? They have the best intentions, and then they start falling behind. What then?
Well, if you fall behind, the best thing to do is to communicate with your creditors. Most companies will work with you to get a plan to get you back on track and make sure you don't fall behind any further. But a credit card itself is an effective tool to show creditors that over time you can maintain your credit wisely and you can manage your balances effectively, and over time show that you have a really good, healthy credit.
And that's where PREMIER then offers that second chance.
Yes. PREMIER Bankcard was founded with the belief that everyone deserves an opportunity to build their credit or rebuild their credit, and we're here for people in their journey.
I love it. I love this last one. Communicate with creditor, work out a plan, choose a credit card that fits you, and move forward and be successful.
Absolutely.
For our viewers out there who'd like more information, where can they go?
They can go to mypremiercreditcard.com. They can also find us on Instagram, Facebook, and YouTube.
Thank you for your time. And if you'd like more information, you know where to go, thebalancingact.com. much for joining us. By the way, check out the QR code you see on the screen.
Share your story. Try to inspire others. Scan the code and share your chronic disease journey and make a difference in your community.
Remember to head to our Facebook page, like us on Instagram, follow us on X, and visit thebalancing.com to enter our latest sweepstake or giveaway.
Love that, family viewers. Stay safe. We'll see you next time.